Welcome to Final BDS MEDC. Null hypothesis is an important 5-marker question from the subject of public health dentistry. Starting with the definition, the null hypothesis, often denoted as H0, is a statement asserting that there is no effect, no difference, or no association between variables. It posits that any observed effect is due to random chance rather than a true effect or relationship. Importance in research. The null hypothesis is crucial in hypothesis testing, a statistical method used to make inferences about populations based on sample data. It provides a framework for evaluating interventions. By comparing outcomes between treatment and control groups, researchers can determine whether an intervention has a significant effect. Determining associations. In epidemiological studies, the null hypothesis helps assess the relationship between risk factors and health outcomes, and ensuring objectivity. Starting with the assumption that there is no effect helps to avoid bias and ensures that conclusions are based on statistical evidence rather than preconceived notions. Next are the steps in hypothesis testing. First one is to formulate the hypothesis. Establish the null hypothesis and the alternative hypothesis which states that there is an effect or difference. Second step is selecting a significance level. Commonly set at 0.05, this threshold determines the probability of rejecting the null hypothesis when it is true. Third step is collecting and analyzing data. Data is gathered and analyzed using appropriate statistical tests, example t-tests and chi-square tests. Fourth step is calculating the test statistic. This involves determining a value that under the null hypothesis follows a known distribution. And last step is making a decision. Compare the test statistic to a critical value or use a p-value to decide whether to reject or fail to reject the null hypothesis. A p-value less than the significant level indicates strong evidence against H0, that is the null hypothesis. Types of errors. Understanding the null hypothesis also involves recognizing the types of errors that occur in hypothesis testing. Type 1 error. This occurs when the null hypothesis is true, but it is incorrectly rejected. The significance level, that is alpha, is the probability of making this error. And type 2 error, that is beta. This occurs when the null hypothesis is false, but it is incorrectly accepted. The power of a test is the probability of correctly rejecting a false null hypothesis. Let us look at an example. Consider a study investigating the effectiveness of a new fluoride treatment in preventing dental caries. The null hypothesis would state that the fluoride treatment has no effect on caries prevention compared to a placebo. Researchers would then collect data, perform statistical tests, and determine whether to reject the null hypothesis based on the results. Rejection and acceptance. Rejecting the null hypothesis. When statistical analysis shows a significant result, that is when p-value is less than alpha, null hypothesis is rejected, suggesting that there is a significant effect or difference. And failing to reject the null hypothesis. When the result is not statistically significant, that is when the p-value is more than alpha, then the null hypothesis is not rejected, indicating insufficient evidence to support a significant effect or difference. That's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.